Hello, and thank you for joining us tonight for our free webinar, Advocacy Training, Learning the Who, What, Why, and How, featuring Dr. Nell Smircina, Dr. Adcock, and David Quackenbush from the CSOMA Leadership team. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. For over 40 years, LASA OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you'll see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our guest speakers, please make sure to use the Questions tab so we see it at the end of the lecture. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive a link to view the video on demand. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the LASA OMS blog. Now for our featured speakers. Dr. Nell Smircina serves as the president of CSOMA. She is passionate about bringing acupuncture into the standard of care and improving patient access to this medicine in all settings. Dr. Nell is the founder of Peak Health, an integrative medical practice in Beverly Hills. She currently coaches students and practitioners looking to make a big impact in the integrative medicine space. Dr. Robin Adcock serves as the executive director of CSOMA's California State Professional Acupuncture Association. She is passionate about expanding access to acupuncture medicine, strengthening patient care, and improving the lives of acupuncture practitioners. Dr. Adcock also serves as the publisher of the Journal of Acupuncture and Integrative Medicine, a CSOMA publication. She currently works at UCSF Benoff Children's Hospital as a researcher, program developer, educator, and clinician of inpatient ambulatory care. Lastly, David Quackenbush is a seasoned nonprofit executive with nearly 20 years of successful track record advocating for healthcare insurance coverage and access for low-income communities throughout California, including healthcare reform and state and local public and private insurance programs. David has led multiple community clinics and health center organizations through reorganization, resulting in expanded resources and staff capacity to fulfill the organizational mission. Lastly, I just wanted to tell you guys who CSOMA is. CSOMA is the California State Oriental Medical Association. They are a professional association of licensed acupuncturists and supporters of acupuncture dedicated to the preservation, advancement, and integration of the art, science, and practice of all branches of acupuncture medicine into the modern healthcare model in a caring and ethical manner, thereby enhancing the health and well-being of the general public. Now, please join me in welcoming Dr. Nell, Dr. Ra, and David.
All right. Good evening, everyone. So I'm Dr. Robin Adcock. Everyone calls me Ra. Thank you all for being here tonight. If you're here, it means you're interested in what's happening in California. It means that you're interested in advocacy. It means you care about this profession in a way that you're willing to go the extra distance tonight and participate in something like this. We are bringing this to you because we believe that this is part of patient care. Advocacy on behalf of our patients, on behalf of our medicine, is an integral part of being able to deliver this medicine. And what's true is that the whole sphere of medicine is changing right now, right? Ever since we saw the opioid epidemic being identified, it's created all of these opportunities for acupuncture medicine. And we were ready to meet those opportunities in so many ways, right? We've been doing research, we've been growing the profession, we've been improving our education standards. And what's true is right now, for us to take advantage of this increasing demand for acupuncture, this increasing awareness, and this desire for patients and other providers to have more pain management options and more whole health options. This has created a huge opportunity for us. And as a profession, if we organize around this time right now and around these opportunities, we will be able to create tremendous change for the next generation of practitioners, for our patients, and for ourselves and our own work. So what's true also is that if we don't organize, we're going to miss out on a lot of opportunities that could help bring this medicine more robustly into the healthcare setting, into the national healthcare, and into more state healthcare, into more insurances, right? So we're all about expanding care, improving care, and improving the lives of practitioners. So that's why we're here tonight. I figured you're here too. If you're here for other reasons, go ahead and put it in the chat. Let us know. We would love to have a lively discussion. We have some things prepared for you guys. We've been presenting like crazy on what CSOMA is doing and on advocacy work. So go to our website, csomaonline.org. There's position papers. There is AB 918, a bill that we've introduced that we're going to talk about tonight, and tremendous other opportunities that that can help inform you more about policy at the state and also national level, where the ASA and the NCCOM are doing incredible work. Okay, thank you, Jeffrey, for putting that up. So a couple quick things about CSOMA in case you're new to CSOMA. We've been around. Next year will be 35 years that CSOMA has been operating, which is really exciting. We are a well-established 501c6. We're a nonprofit. We're almost primarily a volunteer board association. And we're really hitting our stride right now. We have an incredible group of people that are dedicating a tremendous amount of time to bring this and other things to you. So we have 12 board members, just so you have a sense of it. What's interesting about the CSOMA board is that we have very diverse practitioners. So many of our practitioners are dual licensed. So we have acupuncturists that are also massage therapists, acupuncturists that are chiropractors, naturopaths, medical doctors. We've had pharmacists, right? So we have a bunch of people that are dual degreed. And what that means is that we're really understanding how to work with other professions, how to work with this California Chiropractic Association, the physical therapists, the massage therapists, right? To help expand our care. We do have an opening for a student director. So if you're a student out there and something like this gets you excited and you want to be part of it, send us a message at info. I'll put it in info@csomaonline.org, and we can get back to you about any interest there. So what does CSOMA do? So the way we structure our 12 board members is into primarily 4 active committees. One of those committees is Public Policy Action Committee that's bringing you a lot of the work you're going to see tonight. Another of those is the Continuing Education and Events Committee. If you go to csomaonline.org, you'll see a whole list of free for members webinars that basically cover almost all of your required continuing ed or part of it. We're working to expand that more. So by joining CSOMA, you get access to amazing free classes that are happening every month. So you do conferences before COVID, and we look forward to getting back to conferences. We're hoping to do a large 2022, possibly San Francisco or LA, integrative conference that would include practitioners that are interested in acupuncture medicine from all over, and as well as other allied health professions that are interested in referring to us and understanding the medicine. Okay, so we have PPAC committee, the events committee. We have a futures committee that's all about membership and envisioning the future of the profession as well as our organization. And we have a student committee. So again, we're really calling out for more student involvement. Students, you guys, however, I don't know, if you're a student here, put it in the chat, let us know. How many students are here? How many of you are interested in getting involved in the future of this medicine? If you're a student, let us know, because we want more student voices. You're the future of this profession. Your voice is important to help guide the direction that our profession takes. So our board meets all together every 6 weeks, which is amazing. And then our committees meet every week. So if you do want to get involved with CSOMA, it's about a commitment of 2 to 3 hours a week. CSOMA, what else do we do? So if you're joining CSOMA, what do you get? You get to be part of advocacy work like this. You get to support the positive change for the profession and for our patients and for our practices. You get free continuing education classes. You get all kinds of amazing discounts, including specials that are offered by LASA, OMS, and many other amazing services and product vendors in the profession. You also get an annual copy of our medical journal. This is a peer-reviewed research medical journal, the Journal of Acupuncture and Integrative Medicine, JAIM. And we're working on our 3rd issue. Remember, we did have a journal going for 30 years, the California Journal of Oriental Medicine. We're updating our terms and we're refocusing on integrative care. So our first issue was about pain management, integrative pain management. Our next issue was all about integrative acupuncture programs at major medical centers and hospitals. And this This next issue that we're working on right now that's in the editing process is about integrative fertility and reproductive health. So we use this journal not just to inform each other about the work we're doing, but also we send this journal out to medical centers all across the country, to hospital administrators, to heads of anesthesiology departments, and to other decision makers in key settings, to the VA, places where they're deciding how to bring acupuncture medicine in. This is in part what our journal is geared towards, is advancing the medicine, sharing our research and work and doctoral theses, and showing the incredible level of medicine that we're practicing to other professions so they know how to work with us. So why are we here tonight? That's just a little plug about CSOMA, because I couldn't be prouder of being part of this association and the work that's happening now. We're here tonight to really focus on advocacy. And I opened with a little bit about why this time is so important. You know, there has not been a bill introduced in California in 18 years, right? So our profession has been doing well. We've been growing, we've been advancing things, we've been expanding care, we've been teaching our patients, but there's more, right? You guys know that there's more. You know that we need better insurance payouts. You know that we need to be more robustly part of the Medicaid insurance. We want to see more programs at the VA hospitals and military hospitals, right? We want to see stronger practices for sole proprietors. And to make that happen and to stay on top of what's happening in the current healthcare sphere, we have to participate. We have to show up, we have to teach, we have to educate, and we have to ask for what we want on behalf of our profession and on behalf of our patients. So we have to advocate not just for ourselves, but for patients. Because you know, right now, about 2 or 3% of the US population is receiving acupuncture and Chinese medicine care. And we all want to see that more like 80%, right? So I think sometimes we can all get a little focused on what's happening, you know, thinking that there's only a certain amount of people that are going to access our care and thinking that we're really in competition with each other, but we're not. What we're in competition with is pain, is opioids, right? Is other tools that maybe aren't necessarily working as well for many of our patients. And we need to figure out how we get this care to be accessible to people in rural areas, in low income settings, at all education levels, right? There are a lot of barriers to care, and that's what we're here tonight to talk about and start to break down. So that's a little intro. You're going to hear more from me later. You've probably heard a lot from me before, but I'm going to turn it over to Dr. Smircina so that she can talk a little more focused about CSOMA's advocacy work. And again, thank you all for being here.
All right. Hi, everyone. Again, yeah, I'm Dr. Nell. Currently serve as the president of CSOMA. And although this is the CSOMA leadership team that is presenting tonight, the purpose of this is not, you know, to talk about CSOMA specific legislation or, you know, even California specific legislation. We really want to use basically our process that we've gone through and the learning that we've had during that process, because legislation is the new process for us at CSOMA, just to really help inform everyone here. What's really wonderful is that, like Ross said, if you're here, you obviously have an interest in advocacy. You obviously see that there is an importance to actually being involved and being part of your industry and your profession. So we wanted to, you know, give you guys a little bit of information. David is going to go through the actual stepwise process, a little bit more of the logistics, the how-to, the things that, you know, we often get hung up on or don't realize all the steps that are involved. I know when we started this process and ventured down the road of having an advocacy agenda, we realized that so often this profession, we end up being very reactive. There are issues that come up when it comes to legislation or different legal things that come up or different things in the press. And we feel as though we have to, okay, now react. We have to respond to that. We have to respond to dry needling. We have to respond to what's going on with Medicare. And a lot of times we don't really understand the steps to actually being more proactive when it comes to advocacy for our profession. And advocacy does have, you know, these multifaceted layers to it. You know, some of it is always going to be reactive. There are always going to be things that come up that we don't anticipate. But what we've seen over the last year, trying to put these pieces together, see what's really important in California and how that fits into our profession at large, we've really realized that, you know, some things you do need to plan for. And even when you do plan, things happen and you might have to then react at that point. So we want to try to save everyone as much as possible from any misinformation or misunderstanding when it comes to the advocacy process. And I think it's so important that as different states and different organizations are doing this very important advocacy work, that we do share that information and help inform others through that process. I know through my work with CSOMA, and I get Ra wanting to do the CSOMA plug because I've had such a wonderful experience working with this association. I don't think I've ever worked with a harder working, more genuine group of people who have tons of integrity and just love this profession so much. But seeing the passion that everyone has on our very diverse board, like Ross said, having dual degrees, being from different backgrounds, that experience is so important to see where everyone's coming from in this process. And then getting genuine feedback from our members, what's important to, basically the people that we represent when it comes to this profession. That communication is so important. We've seen our association build so much, particularly in the last year, and I absolutely attribute that to listening to our members in the industry. So, some of you who are on this webinar are maybe further down the road than others when it comes to advocacy. Maybe you've been involved in legislation before. Maybe you work with a state association or with ASA. And then some people are here because they just want to know, okay, I'm incredibly overwhelmed. Where do I even start if I do care about this profession? If I want to get a little bit more involved, what can I do beyond submitting my membership dues? And I don't want to take away from the importance of that, because it does allow us as a state association who has a volunteer board to be able to operate, to do different initiatives. So, you're a student, you're, a professional who's working really hard and you don't have that extra time to give for advocacy. Your membership in and of itself is so important and contributes to those efforts. And so we greatly appreciate that. And, the ASA works in the same way. They rely on active members to do that advocacy work. So that's one misconception, that, people are paid to do this work, or, that, everyone is getting something from it. I've seen firsthand through my work with CSOMA and ASA, just a genuine desire to make this profession better. And so part of what we want to share tonight is not just, oh, this is what CSOMA is doing, but California has more than a third of the acupuncturists in the entire country. So what happens in California does advance or, take away from a national agenda. It's something that we have to be really aware of. And really, we can't devalue that. We need to be very cognizant of the responsibility we have in California as practitioners and as leaders in this profession to help bring the medicine forward. I'm sure some of you attended the webinar that was done with ASA and NCCOM going over Medicare. These national initiatives states play a part in, having everyone on the same page, having everyone informed, having everyone excited and interested about different opportunities that are popping up is incredibly important when you're trying to drive a movement like including this medicine into the standard of care, which is absolutely where it should be. And so I'm going to let David take over. Ron, I might pop back before the questions if there's anything that needs to be covered, but we wanted to make this really interactive, make sure we got to everyone's questions. And I'm going to let David take it away with some of the nitty-gritty logistics of how advocacy works.
Thanks, Nell and Ra, and thanks, Jeff, for having us, and thanks for putting the slides up. And again, as both Ra and Nell touched on, this is really about advocacy and encouraging you all to get involved, really regardless of what you support or what you want to see pursued. This is really about encouraging you to get involved, and we appreciate Jeff providing us the opportunity to present tonight. And what CSOMA has done is created an advocacy agenda that has laid a foundation that really goes to help address some of these issues. And I know there's probably way more than these issues that you all confront in your practices, be it if you're a cash pay private practice or you work in a integrated setting that participates in various health plans. we understand there's lots of issues, anywhere from health insurance and dealing with your health plan and visit limits and reimbursement rates, and then maybe some limitations on the scope of practice, and then the education continues to evolve for future generations, and then the need to have some national standard in which the federal healthcare programs are based on, and so what we've created was based on some of these issues. It's not comprehensive, and it's not meant to be the end all to be all, but it's meant to center us on having this conversation tonight. And it's really about getting you all to participate in the process. You all are already advocates. You know, I think sometimes the terminology of advocacy and lobbying, a lobbyist. Technically, I'm a lobbyist, but really it means I'm an advocate for what folks hire me to advocate on, and working with CSOMA. You know, a lobbyist is essentially someone who works the advocacy process and works throughout the process. But really, you are all advocates. In my role, I just implement the CSOMA advocacy agenda under the direction of CSOMA's leadership. So it's not as if, you know, someone like me is going out and doing my own thing. It's based on direction from the association and from other interested parties. But you're all advocates. You already advocate for your patients by providing them services or getting them covered by certain health insurances, depending on what your practice environment looks like. And advocacy is really just activities to influence policy, laws, and budgets. You know, if you're working with your local health plan or medical group to make sure you get reimbursed and make sure your patients' visits are covered, that's being an advocate. It's not any more complicated than that. And it's really just about the individual who publicly supports or recommends a particular cause or policy. We're going to talk about the legislative process, so advocacy is a little more formal in this environment, but you are all advocates in what you do on a day-to-day basis. But as Ra and Nell mentioned, it is critical for you all to be advocates and collaborate so your voices are heard. I mean, I can't stress that enough. In California and in all states, and really at the federal level, most health provider types belong to an association and belong to coalitions to advocate for their profession, be it the medical association or the dental association, or there's hundreds and hundreds of associations that coordinate and collaborate their providers into an advocacy focus. So when they're working with elected officials, be it at the local, state, or federal level, they are working collectively on a variety of issues. And by advocating for acupuncture, you're really working to continue to increase important access to this medicine, and that the medicine is readily available to anyone who wants it. And that's a big part of CSOMA's advocacy agenda, where we want to make sure that anybody who wants acupuncture can get acupuncture, be it cash pay, be it through Medicare, Medicaid, or through private commercial employer-sponsored health plans. It's really about making the medicine accessible to anyone who wants it. The how, as far as the legislative process goes, and this is where we hope to clarify some of the process, help to demystify the legislative process, because it seems it can be overly complicated, it can be intimidating, but there's various ways to participate in the process. Probably the most intense way is to actually introduce legislation and then follow through the process. But you can weigh in on local and state and federal policy however you want, through emails and letter writing and phone calls and meeting with your elected officials and participating in the process. And the key players are really your elected officials at the federal, state, and local levels in their district offices or the state capitol. And I would stress that elected officials like to hear from the providers themselves and like to hear from their providers in their districts. Elected officials will tell you they prefer to spend much more time in their districts talking to the constituents they represent than in the state capitol, be it Sacramento or another state. They really want to be in their district talking to people that they affect directly through their representation. So it's always best to meet with your local elected officials in their district office, which is, typically down the street from your office. It's very easy to find out who your representatives are, and they always prefer those local office visits. And they have district staff that they're there just to help you with whatever issues you have if you're one of their constituents. Professional associations, as I mentioned, professional associations are known commodities in state capitals, be it in the district office or in the state capital itself. And elected officials understand that associations represent their constituents. And then also through coalitions, be it formal or informal. And you see more and more coalitions of different provider groups supporting other provider types. For instance, we have a bill in the legislature currently, AB 918, that we received a letter from the Physical Therapy Association. It's a great example of collaboration from like-minded folks. Rob mentioned this integrative medicine event that we're working on for next year, which is really the point of coalition building. It's coalition building for advocacy purposes, but it's also to share your expertise amongst provider groups that you refer back and forth to, and that are really taking care of the whole person. We hear the terminology whole person care, but that's truly it. And if somebody's seeing you for acupuncture, they're seeing somebody else for primary care or physical therapy or something else. And the more we can bring those provider types together that are working to help the same individual and same communities, the better off we are. And in our coalition building efforts for the bill that I mentioned, but also just for advocacy for acupuncture moving forward, we see these types of people and groups as part of our coalition. The students in the schools, obviously the current practitioners, the national groups, other associations. Patients are a huge constituency that are sometimes overlooked through advocacy efforts. We know, because we have letters from patients supporting acupuncture and supporting different pieces of legislation, that patients want to be actively engaged in supporting you all as their practitioners. So patients are often overlooked, but I would encourage you not to overlook them, because they're your number one supporters. And then business and other individuals. And again, we need to shout out Jeff and LASA OMS because of their support here, just for the profession. It's not even necessarily for CSOMA, even though we appreciate the platform, but it's just for the profession. And they've done way more than just be a business partner. They've been active supporters and advocate for the profession and for practitioners, and they're part of the coalition too. So I would just remind you, as you're working to solidify and strengthen the services you provide to patients, don't forget about your partners in your neighborhood or in your healthcare system and in the state that can really go to support the efforts that you're undertaking. The process is a bit overly complex and somewhat convoluted, but just to kind of spell it out, because in preparing for today, we wanted to cover a little bit of the basics just so we can help clear up some of the confusion. But the legislative process is you introduce legislation. Depending on the subject matter of that legislation, it goes through various committees. And for instance, our bill, AB 918, affects acupuncture licensure. So it goes to the Assembly and Senate Business and Professions Committee. But it goes to the committee, then it goes to the Appropriations Committee, then it goes to the full floor, and then it does the same thing on the Senate side, and then it goes to the governor for a signature or veto. So it's a pretty lengthy process. And typically it's going to have at least 6 different hearings, be it on the floor or in the committee, for really any type of legislation. So getting a bill introduced is one thing, but shepherding it through the process is a whole level of effort. And in California, it's a 2-year process. So actual bill introduction and going through the committee process can take 2 years. This is different state to state, because some states have different timing on their legislative process. But because CSOMA is California, we wanted to mention the California legislative process. So California has a 2-year session. We just started the first year of the session, And technically it started back in December. So in December, the legislature started. February was the bill introduction deadline. You all hear about the state budget constantly, and it does have impacts to provider. It's really because all of the health insurance programs, be it Medicaid and other state-sponsored programs, are all funded through the state budget process. And as some California practitioners would probably remember, last year when COVID hit and there was basically a panic on how the economy will be impacted, at one point during the budget process last year, cutting acupuncture from Medi-Cal was being considered. So the state budget definitely has an impact on how you practice and patient access to your services. So the state budget has a constitutional deadline of June 15th every year. And then the bill introduction deadline, as I mentioned, was February, but then it could be amended all the way up to September. And then it has to pass by September 10th. And then all legislation has to be passed by September 10th. And then the governor has a month to sign it. And he either signs it or he vetoes it. And once it's signed, it becomes law the following January, unless it has an urgency clause. And essentially an urgency clause means as soon as the governor signs it, it's enacted in law and it's active. So let me just go back real quick because I went through that a little quickly. I just want to stress for those of you who want to engage in the process, there are various opportunities to engage in the process. And between the bill introduction deadline and the bill amendment deadline, so that's 6.5, 7 months, there's the various committee hearings in which to engage the public and practitioners. And that's when you make phone calls, you send emails, you write letters of support or opposition. That's where you really engage with your elected officials. And just to add some nuance to that, if it goes to a committee that your representative happens to be on, that is your best opportunity to affect that piece of legislation. So if your assembly person is on a committee that the bill goes in front of, you would contact that assembly person's office to express your opinion, be it support or oppose. And that's what they really, really like, right? Because they want to know what individual bills do to impact their constituents. So that's where you can have the biggest impact when it's getting ready to be heard in a committee in which your local elected sits on. And I should just mention, every elected official sits on typically 3 to 4 committees, and they're usually assigned every legislative session. And so if you went to the Assembly website or the Senate website, you can find out where your elected official, what committee they sit on, so you can really know how to have that impact. Even though when it goes to the Senate or Assembly floor, every elected official will vote on the bill. So you still have an opportunity to impact the legislation. But again, if it goes in front of your elected official as they're participating in the committee they're assigned to, that is your biggest opportunity to have impact. So we touched a little bit about this, and I just want to underscore that CSOMA is a statewide association of acupuncturists. They exist to advocate for acupuncture. And the focus is really working to ensure acupuncture services are integrated into the healthcare delivery system, just like any other type of healthcare service. So if a patient wants dental care or vision care or primary care doc or acupuncture, CSOMA's goal is to have acupuncture integrated and accessible just like any other medicine that patients want at their provider when they want it. So that's very important. CSOMA's advocacy agenda is threefold. It's access to care, healthcare delivery system, and primary care integration. It's really around making sure acupuncturists are covered by every type of health insurance. They are reimbursed at an appropriate level that is financially viable for you all to provide those services. Because I know many providers, not just acupuncturists, but I know many providers that won't participate in health insurance programs because they are not reimbursed at an appropriate level. We know that's a real issue. And one of our pillars of the advocacy agenda is to work on making sure you all are reimbursed at the appropriate level. Healthcare delivery integration, which we spoke about, and primary care integration. Really, you're already treated as primary care, which means you don't have to get a referral. Your patients don't have to get a referral to see you. But we also want to make sure you're all able to practice at the full scope of practice. And we are also in the process of reviewing the scope of practice to see if there's opportunities to expand the scope of practice based on services that acupuncturists want to add to their services. So CSOMA went through a very lengthy planning process to get to this stage of an overall comprehensive advocacy agenda. Yes, we do have one bill this year, but it's a small part of a much broader initiative that will be going on for many, many years to come. So I'll stop there. I think I covered it all. Raw, Nell, I don't know if you want to add to that before we open it up for questions.
Yeah, I would love to just piggyback on what you were saying about coalition building. This is kind of my sweet spot and happy space. So I really believe that networking is everything. Relationships are everything. And I think when I first got into advocacy work, I didn't really understand those connections. Like, you think about the idea of, oh, like, I need to have connections within the legislature in order to do advocacy work. You know, it's much larger than that. And even if you are in an association or you're an individual and, you know, the association that you're with doesn't have a bill that's active, this coalition building should be happening all the time. And it's only going to benefit you as an individual, being more informed in your industry and this profession, and also benefit whatever association you're a part of, because those connections mean a lot. And like David said, you know, thinking about patients, that is often an overlooked, you know, portion of this coalition building when it comes to advocacy. You never know, even patients who they are constituents of, who they have connections with as well. And coming from a very genuine place of wanting to do the right thing in your industry and advance your profession and come at this from a patient-centric viewpoint, you really can have an impactful experience with these different coalitions. So a lot of times when you're thinking, oh, we're doing healthcare advocacy work, of course, we want to reach out to other people within our same industry, but we want to reach out to other strategic healthcare partners and other strategic organizations, whether it's your local chamber of commerce that may know someone in the legislature, or, you know, they just might know someone that you want to connect with at a later date. But that's something that, whether or not you have a specific bill that you're trying to support, or you're in a specific part of a legislative agenda, that coalition building needs to continue to happen. And every one of us has a different area of that where we're going to shine. You know, for the CSOMA board, yes, I'm in private practice and I teach in some of the schools, but we have, you know, a board member who works for the VA. And so he has different connections than I do. You know, Ra works with UCSF, so she has different connections than he does. So really leveraging your own unique experience and thinking, hey, you know, what can I bring to the table when it comes to this advocacy work? How can I help coalition build? It's not always as obvious as you think it is, but it can be incredibly impactful when you look at this as a long-term play and are really just coming from this genuine place of wanting to build this consensus and bring people along for the ride for a really powerful mission. Rob, was there anything you wanted to add?
Absolutely. I'm going to add something to that. And it's so exciting to talk about this. I guess just one of the points that I want to make is I've been involved with CSOMA for 8 years, and we've really only gotten better at advocacy in the last few years. And what I didn't realize before are two things. Number one, It's fun. I had no idea how much I would learn or how exciting it would be to not just learn the political realm, because that can feel a little overwhelming, right? But to reach out, to talk to other professions. In just the last 2 months, CSOMA has talked with the Physical Therapy Association of our state, the Chiropractic Association, the Naturopathic Association, the Department of Defense, the Veterans Association, the UC system, and that's just to name a few. And all of these meetings, we learn so much about what's needed, about what opportunities are out there, and we learn things we would have never thought about, and we just meet really cool people. Because what's true is that if you're doing this and you're connecting with other people that are doing this, they are equally impassioned, coming from wherever they are. So it's really a meeting of the minds, and that enthusiasm grows exponentially. It's contagious and it's exciting. So that's one of the things I didn't realize. I thought it would be kind of challenging and overwhelming. It can feel that way in moments, because sometimes, especially when you introduce legislation, gets a lot of momentum going. And so it is a bit like, riding a wave, like big wave surfing in California. But it's fun. So that's the first thing that I want to know, that I want to share with you guys, is so far this has been fun for us, and we're really growing and enjoying the people that we're networking with. The other thing is that it's easy to think that we're going into this with an ask, right? And we want more access to care for our patients. We want better paying insurance payouts, right? We want more opportunity to deliver this medicine. But what I didn't realize is that we're actually the gift. We are not coming with our hands out. We're coming with highly skilled, trained hands that are underemployed and underutilized in the medical system. And what's true is that people on the other side are looking for the solutions that we bring. They are looking for more healthcare, for more whole health, total body healthcare systems, which Chinese medicine is one of the few systems that is that. They're looking for pain management options, right? They're looking for so many things that we have. So we are the gift, and we just need to connect with the right person that sees that. So it's not like we're going with our hands out, even though we're going with an ask. And just the last thing I'll say is, politics is politics, and I'm not going to lie and say that it's easy. You have to have a thick skin, and you have to stay focused. I'm learning this. This is where it's really helpful to have a consultant work with you, the way we have David Quackenbush, to help keep us focused. But it's rewarding. It's worth it. And anytime it gets confusing, there's one question that clears up our next steps in CSOMA and guides us anytime it can feel confusing, is what's best for our patients. What's best for patients. And then all of a sudden, all of that nonsense just clears, and we're very focused on how to move forward for this. So those are just a couple things that I wanted to share. Advocacy work can be really fun and rewarding, and help you grow as a practitioner and open up opportunities you could have never imagined. That really, we are the gift that are coming there, and that it's worth it. So that's just a couple things I wanted to share. And now it's, maybe we take some questions. Unless you guys have anything else to share.
It'll come out in questions.
Yeah.
Hi, guys. I'm back. Thank you so much for that information. It was super helpful. We do have a couple questions, so I will get to those right now. So first one is, what are we doing to work with the American Medical Association to further our integration opportunities across the medical community? Do you feel this is a synergy that will benefit our cause?
Yeah, so it's a great question. So absolutely, the AMA is hugely important. And what's true is I think that, our profession has grown really quickly. I mean, in California, we didn't have a Practice Act until the 70s, right? So we haven't, so we're still establishing ourselves. And it's just in the last few years that we're seeing a critical accumulation of research and understanding of this medicine to drive forward the demand. The AMA is a hugely important part of this. And I think a lot of those discussions happen at the ASA level, at the national level. And that's where your involvement in your state associations and their involvement in the ASA is so important. So we will be working with the California chapter of the AMA, and what's true for me is working at UCSF, I work alongside people of every type of medical discipline that you could imagine. And every profession deals with its issues. And the AMA, I think, has been really supportive, and even medical acupuncturists have helped open the way and train and create opportunity for us to come in, because, I just think that we can get concerned about other practitioners, and really these other practitioners, when everyone is being respectful, professionally respectful, the AMA, chiropractors, PTs, naturopaths, that we are more alike than we're not. So in working with them, it's really important, and it's an area that we intend to grow more in California with the California chapter.
And to be clear, a few years ago, a main concern would have been, oh, we're not accepted when it comes to major healthcare. Oh, people have questions about the efficacy of this medicine. The good news is people are fighting to use our medicine right now. And so if that is our biggest problem, that we need to be more cognizant of the fact that others in, larger healthcare professions are so eager to use the tools that we've shown to be effective. That's not a terrible problem to have. It certainly requires a different type of strategy. But at the same time, it is exciting because it shows that there is more widespread enthusiasm for what this profession brings to the table and how that impacts patient care.
All right. So next question is about the bill 918. So somebody wants to know, is there a coalition of support from other California stakeholders other than CSOMA? And they'd also like to know about the impact that AB 918 might have on the California Acupuncture Board budget.
So I'll take that one. Legislation is a process. You saw the timeline I put up, and we're going through the process. There's been a lot of confusion and misinformation, and to some facts, misinformation has been spread purposely. So we're going through the process of educating stakeholders. We have letters from other state associations, practitioners, and students and schools, and it's a process. So the impact on the budget, on the acupuncture board budget, is our position is, if we were going to implement the national exam in California in lieu of the California exam, and that's, we're still in the process of negotiating that, it would save the acupuncture board money because they would no longer have to administer an exam. But I don't want to oversimplify, because it's a process. An exam, there's an ongoing negotiation. The exam pieces would have to be negotiated. There would have to be a transition period. But we believe ultimately, which I think is somewhat commonsensical, if the California board doesn't administer an exam, ultimately they're going to save money.
And I think David brings up a good point, just focusing on the fact that advocacy work is a process. We've learned a lot in the last few months since we introduced a bill. And it's been interesting to hear that there's commentary on, this wasn't done quite right, or the bill language isn't perfect. And that's actually not how policy happens, right? This is an ongoing discussion. It can be a discussion for 2 years to keep refining and fine-tuning legislative piece to make it make sense for the most people. So what CSOMA is really focused on is the quality of process, is really trying to reach out, trying to hear as many different inputs as possible, students, schools, other practitioners, other professions, whoever's willing to talk with us in a productive way. We're interested in hearing what you have to say, because we want this to be the best for all. So it's easy to think like everything has to be perfect and wrapped up in a bow, and that's not really how it happens. You kind of start in, and it's kind of like making a meal. You start with a bunch of ingredients, and then you kind of keep cooking it together. And in this case, the more chefs that can be in the kitchen and be respectful, the better. So just, if you are interested in doing advocacy work, just know there's no perfect place to start. You're not going to have all the answers in the beginning. It's not going to be perfect. And just keep committing to being open and talking with people, really trying to hear what concerns are, and keep fine tuning it to make it work as best as possible for as many people as possible, especially our patients.
And looking at the big picture of, like you said, the process, we have to think the process also gets muddied by situational stuff as well. So like COVID happened, the legislative climate is different. So we can map out, this is the legislative process in California. But as far as like what the legislature's priorities are going to be, a lot of different factors will be influenced by what's going on in society at that time, what the budget is looking like in the state. So many things, make for this recipe that Rob was talking about. And so it's not a perfect science every time. You're going to have to roll with the punches, and see that it is going to be different each time you step up to the plate. So
I would just add also that this bill is, again, as I said earlier, is just one piece of a much broader advocacy agenda. And this bill has also stimulated conversation that would not have happened before, and has created new partnerships for us that will continue to help implement the rest of the advocacy agenda. So it's actually been a pretty positive experience.
It's been an amazing experience, and our membership has grown. And I saw a question here about membership before. Our membership has grown by a third in just the last year. We were preparing to see downsizing. We thought that there would be more practitioners that would have to pull away from joining their state associations. And what we've seen in California is actually is people getting more involved. Maybe they have the time and the focus, or maybe they see more than ever that we need to be at the table of healthcare discussions and trust CSOMA to be able to deliver that message in a way that represents the medicine well. So we've seen tremendous support, including a school in California that just registered all of their students. The school is very involved in advocacy. We'll be releasing a press release about this week, and is so supportive in what's happening. They wanted every one of their students to be a member and decided to do that, to implement that membership. So it's really exciting to see when I think we all want to have a voice, but how do we do it? And it's easy to feel like you're only one person or just a small association, a volunteer association, but with a little bit of focusing and we've had David to help guide us, which has made a huge, tremendous impact. We're suddenly operating at a whole new level. We're seeing all these things possible that we hadn't thought were possible before. And so that's really exciting. Yeah.
I'm trying not to get distracted by all the great questions. And I did want you guys to know, we don't want to make this about our bill. We wanted to make this a bigger picture conversation so it's applicable to everyone. But if you want more information specifically about AB 918, you can check our website. We have fact sheet, frequently asked questions, all of that. I just want to make sure we have enough time to get to the bigger picture questions that everybody probably has.
Yeah, it was really our hope to say, wow, we're doing this, and and we want to share it with you guys so that you see that it's possible, that you can do it in your state, so that you can be part of it in California with us if you're here in California, and to say, it's not so scary, and it's a really amazing experience. So.
Wow, we do have a question about insurance billing. I'm not sure it's 100% on topic, but I'm going to ask it anyways. Because I know that it's a common question with practitioners. So dealing with insurance companies is challenging with Western medicine as well as Oriental medicine. The biggest challenge is very low reimbursement and mastering the billing that helps increase our income. Do you guys as the association provide any guidance with billing?
Yeah, so we actually very thankfully have increased our corporate sponsorship by 9-fold in this past year. So we have some really incredible corporate partners who have way more information about this than we do. So MIEC and AAC, two medical malpractice companies, are corporate sponsors, and they are often doing education and providing guidance when it comes to this. There were a lot of questions about telehealth and the changes with billing and coding with that. And they're able to provide really good information. And I know AAC on a regular basis will, actually host webinars specifically on this topic. So that would be the guidance that we would typically give. I don't know, Ra or Dave, if you have
and I would just add, and Nell talked about partners that do the mechanics of billing, but in the advocacy agenda and high on our list is to do some advocacy around reimbursement rates. It may not necessarily be a legislative needed solution, but we do intend to have direct conversations with health plans and provider groups to come up with an approach to make sure, and as I mentioned earlier, it's really about making sure you all are reimbursed appropriately so patients have access to the medicine. So it's high on our list. We do intend to do some work. But as Nell mentioned, there's companies that do the mechanics of it, but we definitely have some advocacy ideas to help increase the reimbursement rates.
And this is where the coalition we've been forming around this particular bill, even though the bill has to do with exams and is very much inside the profession, the fact that we're doing such a proactive outreach to these other groups and major influencers in the state will help us when it comes time to have larger discussions, right? Can you imagine a time where you have a whole hospital system advocating for better insurance payouts so they can deliver acupuncture to their patients, right? So this is what we're looking at. And this is why the CSOMA board has board members that are at the VA and in the, I'm at UCSF, and we have other people that are in the UC system. So this is part of what we're trying to do, is do the work on the inside, get the information, bring it back into this association, and then turn it into advocacy and policy work in a collaborative way. So we have these other major strong voices working on behalf of the acupuncture profession. Because even with, what do we have, 50,000, I'm not sure the ASA numbers in the state, maybe 50,000 practitioners in the whole country. We need to have other people advocating for us in other professions. We need nurses. We need, we need MDs. And, what's true is it's easy to think, if you're isolated, that these folks want to kind of steal our scope. And that's really not the case. People are really busy doing their own scopes in these integrative settings. And working on an integrative team, it's easy to see how much demand there is for this. So these other professions and groups, these are our allies. And we need to work with them to advance this medicine. Of course, always keeping professional respect and clear scope of practice in place. So insurance is hugely important, not just because we need to make a living, pay off our student loans, but because our patients need to have benefits that they can use to come see us.
Well, thankfully, to all of the work that the Massachusetts Association has done, I now finally have acupuncture benefits, and it's required for all Massachusetts carriers to have acupuncture coverage for pain management. So it does work. So do it.
I think a lot of that is the Massachusetts Association and Amy Major, and she's a leader in that. And she's also, she could be doing the same webinar. She's done such incredible work in Massachusetts, and see how it directly comes back to help you as a patient, right, Jeffrey? So it's exciting.
Exactly. I'm very excited about it. So I just wanted to share that because it was a very happy story with a good ending. Let's get on to another question, because we actually have some really good ones here. So is there any pressure to ensure acupuncturists begin to formally specialize? I've heard that by us beginning to do that, we improve our footprint and respectability in the medical community. Right now, there's no demand that we do that upon graduation.
That's a good question, Zakia. I hope I'm saying your name correctly. And I thank you so much. You've been really involved tonight with great questions and involved in the chat. So I haven't met you, but your enthusiasm is contagious for me. Part of what makes our medicine so amazing, right, is that we can treat almost anything that comes through the door, right? We have to be careful how we language that with COVID or oncology or things like that. But we are able to, because we treat the patient, we're able to do so much. However, what you're seeing, I'm sure if you're just reading magazines, is that there is demand for us to specialize. I'm a pediatric specialist, for example. And within that, I'm a pain management and palliative care specialist for pediatrics. So I definitely have specialized. And I think it does help our medicine, because I think we still have a lot of education to do. And there's still the impression that acupuncture is for relaxation and for pain management only. And I think that when other providers and patients start to see, especially other providers, start to see how much we can help specific issues like, blood pressure, for example, or constipation, right? Whatever it is, I'm in a hospital setting, right? So I'm thinking about things that I see where people go, wow, I didn't know acupuncture could do that. So it's natural for us as a profession, as we're growing, to start having specialties. I don't think I don't see anything on the horizon where there will be a push to have to specialize. What I see is tremendous opportunity for us to find the passion spots that really drive us and get us up in the morning and make us excited, or some patient population we're drawn to work with for whatever reason. Our medicine is so flexible. And that's part of the gift of Chinese medicine, is its flexibility. It does allow us to go down these specialty avenues, which can create more demand or value for services. I don't think from an education point of view that we will see any mandates that happens. However, it's just part of the gift of this incredible medicine that we're part of.
It looks like there is a question about some new regulations around telehealth in California. So does CSOMA have a position on these new regulations around telehealth?
Yeah, I would just say for position papers that CSOMA is putting out, telehealth is something that we're discussing. It's certainly been part of our advocacy work, and there's more information at csomaonline.org.
Perfect. It looks like I don't see any other questions in here. So if that's all for tonight, I want to thank you guys so much for your time tonight to share this with our audience. I think it was really helpful, and it's really nice to see that advocacy is not scary. It's attainable. It's accessible. Anyone can do it. I want to see, do any of you guys want to say anything before we go?
Just a thank you to you. You're really good at this, and we appreciate the platform.
Well, we appreciate you guys for all that you do. For everyone that's a member of your own state association, whether it's in California or a different state, we thank you for all of the work that you do. If you're not a member, please join. There's a link in the email that goes out afterwards that will take you to the CSOMA website. And if you're not a California practitioner, there's also a link that will take you to the ASA page where you can find your own member state association. Again, thank you so much to you guys for your time. Thanks for everyone for showing up tonight. Next up is on Thursday next week. It is Chinese Medicine and Dermatological Conditions featuring Martha Lucas. So please show up for that. Again, thank you and have a wonderful night.
Thanks.
Thanks,
Good
everyone.
night.